Cocaine is derived from coca leaves, originally used for stamina and alertness. It works by blocking the reuptake of dopamine, norepinephrine, and serotonin in the brain. This leads to a buildup of dopamine in the synapses, producing intense euphoria, confidence, and energy. However, the effects fade quickly, causing a severe crash marked by fatigue, depression, and irritability. The drug's vasoconstrictive properties restrict blood flow, raising heart rate and blood pressure, which increases the risk of heart attack or stroke. Repeated use damages the brain's reward pathways, leading to addiction and tolerance, requiring higher doses for the same effect. Over time, it can cause paranoia, cognitive decline, and nasal tissue destruction from snorting. Chronic exposure disrupts natural dopamine regulation, leaving users unable to feel pleasure without the drug. These neurochemical changes are often permanent, creating lifelong dependency and emotional instability. Amphetamine, commonly known under brand names like Adderall, is a central nervous system stimulant primarily prescribed for ADHD and narcolepsy. It works by increasing the release of dopamine and norepinephrine in the brain, chemicals responsible for focus, motivation, and alertness. In therapeutic doses, it enhances concentration, reduces impulsivity, and promotes wakefulness. However, at higher or non-prescribed doses, it produces euphoria, hyperactivity, and elevated energy levels, making it highly addictive. Chronic use can lead to tolerance, where larger doses are needed to achieve the same mental boost. This stresses the cardiovascular system, raising heart rate and blood pressure and increasing the risk of stroke or heart attack. Long-term misuse disrupts natural dopamine balance, resulting in anxiety, insomnia, and severe mood swings. Sudden discontinuation after dependence may trigger fatigue, depression, and cognitive fog due to neurotransmitter depletion. Methamphetamine is one of the most potent stimulants known to science. It floods the brain with dopamine, producing a powerful, long-lasting high that can last up to 12 hours. The drug drastically accelerates heart rate, blood pressure, and body temperature. Meth forces nerve cells to release massive amounts of dopamine while blocking its reuptake, creating extreme euphoria and energy. Over time, this flood of neurotransmitters destroys dopamine receptors, leaving users unable to feel pleasure without the drug. Chronic meth use leads to insomnia, hallucinations, violent behavior, and rapid physical decay, known as meth mouth. The neurotoxicity it causes can permanently damage brain cells, particularly those regulating emotion and memory. Prolonged exposure can also induce psychosis, similar to schizophrenia, often persisting even after stopping use. Organ failure, malnutrition, and severe cognitive decline are common among long-term users due to meth's destructive metabolic effects. Caffeine is the most widely consumed psychoactive substance on Earth, found in coffee, tea, soda, and energy drinks. It acts by blocking adenosine receptors in the brain. Adenosine normally promotes sleep and relaxation, so when caffeine prevents it from binding, neurons fire more rapidly, creating a feeling of alertness and wakefulness. This triggers the release of adrenaline, increasing heart rate, blood pressure, and energy metabolism. In moderate amounts, caffeine improves concentration, reaction time, and mood. However, excessive intake causes jitteriness, insomnia, rapid heartbeat, and gastrointestinal discomfort. The body builds tolerance quickly, requiring more to achieve the same stimulation. When consumption stops abruptly, adenosine floods the receptors, leading to withdrawal symptoms such as headaches, fatigue, and irritability. Despite its short-term cognitive benefits, chronic overuse can disrupt sleep cycles and raise anxiety levels, making dependency both physical and psychological in regular users. Nicotine is a potent alkaloid found naturally in tobacco leaves. It acts as both a stimulant and a relaxant by binding to nicotinic acetylcholine receptors in the brain, rapidly triggering dopamine release. This produces pleasure, focus, and a calming sensation within seconds of inhalation. Over time, the brain adapts by reducing its natural dopamine production, creating dependency and withdrawal when nicotine levels drop. Physiologically, nicotine constricts blood vessels, raises heart rate, and increases blood pressure, placing stress on the cardiovascular system. Repeated exposure also heightens insulin resistance, contributing to metabolic issues. Withdrawal symptoms, such as irritability, anxiety, restlessness, and intense cravings, can appear within hours of quitting. Although nicotine itself is not carcinogenic, its delivery through smoking introduces thousands of toxic chemicals that cause cancer and respiratory disease. Even nicotine replacement methods must be managed carefully to prevent reinforcing the addiction cycle. Lysergic acid diethylamide, or LSD, is a synthetic hallucinogen derived from ergot fungus. It profoundly alters perception, thought, and mood by binding to serotonin receptors in the brain, particularly the 5-HT2A receptor. This disrupts normal communication between brain regions, creating visual distortions, time dilation, and a sense of ego dissolution where the boundary between self and environment blurs. The experience, often called a trip, can last 8 to 12 hours. Although LSD is not physically addictive, tolerance builds rapidly, requiring higher doses for the same effects. Mentally, the drug can trigger intense introspection or terrifying hallucinations known as bad trips. In rare cases, users develop hallucinogen persisting perception disorder, HPPD, where visual distortions reappear long after use. Physiological effects include dilated pupils, elevated blood pressure, and increased body temperature. LSD's unpredictability lies in dose sensitivity and user mindset, making each experience uniquely powerful or distressing. Psilocybin is a naturally occurring psychedelic compound found in over 180 species of mushrooms. Once ingested, the body converts psilocybin into psilocin, which interacts primarily with serotonin receptors in the brain. This alters communication between neural networks, leading to vivid visual patterns, distorted sense of time, and deep emotional shifts. Users often describe heightened empathy, spiritual awareness, and a dissolving of the ego. The effects usually last 4-6 hours. Recent studies suggest that psilocybin can reset overactive brain circuits associated with depression and anxiety, offering potential as a psychiatric treatment. However, unpredictable outcomes remain. High doses can cause panic, confusion, or paranoia. Physiological effects include nausea, increased heart rate, and pupil dilation. While not considered physically addictive, psychological tolerance develops quickly. Psilocybin's power lies in its ability to temporarily rewire consciousness, exposing both profound insight and psychological vulnerability. DMT is a naturally occurring tryptamine found in certain plants, animals, and even trace amounts within the human body. Structurally similar to serotonin, it binds to 5-HT2A receptors, creating an intense, short-lived psychedelic experience, often lasting only 5 to 15 minutes when smoked or vaporized. Users report complete immersion into complex geometric visuals, encounters with entities, and sensations of leaving the physical body, commonly referred to as a breakthrough. Unlike LSD or psilocybin, DMT's effects come on almost instantly and end abruptly, but the psychological impact can feel timeless. Physiologically, it elevates heart rate, blood pressure, and pupil size. Though the body metabolizes DMT rapidly, it cannot be taken orally unless combined with an MAOI, as in ayahuasca. While not addictive, it profoundly alters perception and can trigger anxiety or dissociation if used irresponsibly. Its mysterious role in human neurochemistry continues to be widely studied. Ketamine is a dissociative anesthetic originally developed for surgical use in the 1960s. It acts primarily as an NMDA receptor antagonist, interrupting communication between neurons involved in pain perception and memory. At medical doses, it induces sedation and pain relief without suppressing breathing. In recreational or uncontrolled settings, it produces a detached, out-of-body sensation, visual distortions, and loss of coordination, an effect known as dissociation. These experiences, sometimes called a K-hole, can feel dreamlike or terrifying depending on dosage and environment. Physiological effects include increased heart rate, elevated blood pressure, and impaired motor control. Chronic use can damage the bladder and urinary tract, a condition called ketamine cystitis. Recently, low-dose infusions have shown rapid antidepressant effects in patients resistant to traditional medications. Despite this potential, unsupervised use poses serious risks of psychological dependence, memory impairment, and long-term cognitive decline. MDMA, or 3,4-methylenedioxymethamphetamine, is a psychoactive compound that combines stimulant and hallucinogenic properties. It primarily increases the release of serotonin, dopamine, and norepinephrine in the brain, creating intense feelings of empathy, emotional connection, and euphoria. Users often experience heightened sensory perception and a strong desire for social interaction. The effects last 4 to 6 hours, followed by a come down as serotonin stores become depleted. This can lead to depression, irritability, and fatigue for days afterward. Physiologically, MDMA raises body temperature, heart rate, and blood pressure, increasing the risk of dehydration or heat stroke, especially in crowded environments. Repeated or high-dose use can damage serotonin-producing neurons, leading to long-term mood and memory problems. Though studied for therapeutic use in PTSD treatment under medical supervision, recreational use often involves impure forms adulterated with other stimulants, significantly increasing toxicity and overdose risk. Alcohol, or ethanol, is a central nervous system depressant that slows brain activity by enhancing the effects of the inhibitory neurotransmitter GABA while reducing glutamate activity. This dual action produces relaxation, lowered inhibitions, and impaired coordination. Initially, it increases dopamine release, which reinforces drinking behavior through short-term pleasure. However, as blood alcohol levels rise, reaction time, judgment, and motor control deteriorate. Chronic consumption alters brain chemistry, leading to dependence and withdrawal symptoms such as tremors, anxiety, and seizures when intake stops abruptly. Long-term effects include liver damage, fatty liver, hepatitis, cirrhosis, cardiovascular disease, and permanent cognitive decline. Alcohol also disrupts REM sleep and hormone regulation, weakening immune and digestive functions. Beyond physiological harm, it remains a major contributor to domestic violence, traffic deaths, and addiction-related disorders worldwide, illustrating its dual nature as a socially accepted yet profoundly destructive substance. Benzodiazepines are a class of prescription sedatives designed to treat anxiety, insomnia, and seizures. They work by binding to GABA-A receptors in the brain, enhancing the effect of the neurotransmitter GABA, the body's main inhibitory signal. This calms neural activity, reducing anxiety and inducing relaxation or sleep. Common examples include alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. When used as directed, they are effective short-term treatments, but tolerance develops quickly. Prolonged use causes the brain to rely on the drug for calm, leading to physical dependence. Abrupt withdrawal can result in severe anxiety, tremors, and even life-threatening seizures. Combined with alcohol or opioids, benzodiazepines can dangerously suppress breathing. Chronic misuse impairs memory, coordination, and emotional regulation. Because of their rapid onset and euphoric relief from stress, they carry a high potential for addiction and are among the most overprescribed psychoactive drugs worldwide. Barbiturates are powerful central nervous system depressants once widely used as sedatives, anesthetics, and anticonvulsants before benzodiazepines largely replaced them. They work by prolonging the opening of chloride ion channels linked to GABA receptors, producing deep sedation, muscle relaxation, and at higher doses, anesthesia. Small increases in dosage can sharply intensify their effects, making the line between a therapeutic and lethal dose very narrow. This high overdose potential caused thousands of accidental deaths in the mid-20th century. Physiological effects include slowed breathing, reduced heart rate, and impaired coordination. Long-term use leads to tolerance, requiring larger amounts to achieve the same result, and abrupt withdrawal can cause seizures or fatal delirium. Today, barbiturates remain in limited medical use for specific conditions such as epilepsy or assisted anesthesia. Their steep dose-response curve and strong respiratory depressant action make them extremely dangerous outside controlled clinical settings. Gamma-hydroxybutyrate, or GHB, is a central nervous system depressant naturally present in small amounts in the brain. It acts primarily on GABA-B and specific GHB receptors, producing sedation, relaxation, and euphoria. Medically, it's used under strict supervision to treat narcolepsy and certain sleep disorders, but recreational use is highly risky. The difference between a euphoric dose and a toxic one is very small. Overdose can quickly cause vomiting, seizures, respiratory arrest, or coma, When mixed with alcohol or other depressants, its effects multiply, leading to a high risk of fatal respiratory failure. GHB's clear, tasteless liquid form has also made it infamous as a date rape drug. Repeated use causes rapid tolerance, intense cravings, and severe withdrawal symptoms, such as anxiety, tremors, and delirium. Despite its brief duration of action, dependence can form quickly, and unsupervised withdrawal can be medically life-threatening. Opioids are a class of drugs that act on the brain's opioid receptors to block pain and produce intense euphoria. Natural opioids like morphine are derived from the opium poppy, while heroin and fentanyl are synthetic or semi-synthetic variations. These substances mimic endorphins, the body's natural painkillers, but in far greater intensity. When they bind to receptors in the brainstem, they slow breathing, lower heart rate, and dull pain perception. The resulting sense of calm and well-being makes them highly addictive. Over time, the brain reduces its own endorphin production, leading to dependence and withdrawal symptoms such as severe pain, nausea, and anxiety. Fentanyl, up to 100 times stronger than morphine, is especially lethal because even microgram doses can stop breathing entirely. Long-term use causes tolerance, organ stress, and collapsed veins, making opioid addiction one of the most destructive public health crises globally. Cannabis contains over 100 active compounds known as cannabinoids, the most significant being THC, tetrahydrocannabinol, and CBD, cannabidiol. THC binds to CB1 receptors in the brain's endocannabinoid system, altering neurotransmitter release and producing relaxation, altered perception, and mild euphoria. CBD, on the other hand, interacts weakly with these receptors and counteracts THC's anxiety-inducing effects while offering anti-inflammatory and neuroprotective benefits. Short-term use slows reaction time and impairs memory and coordination, while chronic heavy use can disrupt brain development in younger users and reduce motivation or cognitive performance. Medically, cannabis is prescribed for chronic pain, epilepsy, and chemotherapy-induced nausea, though dosage and strain determine effects. Physiological impacts include increased heart rate and appetite, dry mouth, and red eyes. While dependence risk is lower than with stimulants or opioids, tolerance and psychological addiction can develop with frequent use, especially in high THC strains. Selective serotonin reuptake inhibitors, or SSRIs, are a class of antidepressants that increase serotonin levels in the brain by blocking its reuptake into neurons. Common examples include fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro. By maintaining more serotonin in the synaptic gap, these drugs help stabilize mood, reduce anxiety, and alleviate depressive symptoms. However, their therapeutic effects take several weeks to appear because the brain gradually adjusts receptor sensitivity. Side effects may include nausea, insomnia, weight changes, sexual dysfunction, and emotional blunting, where users feel emotionally flat. Abrupt discontinuation can cause withdrawal symptoms such as dizziness, irritability, or brain zaps. While SSRIs are non-addictive, dependency can develop psychologically if stopped without medical supervision. They are highly effective for many patients but must be closely monitored to prevent serotonin syndrome, a potentially dangerous condition caused by excess serotonin in the nervous system. Anabolic androgenic steroids are synthetic derivatives of testosterone designed to promote muscle growth and enhance physical performance. They work by binding to androgen receptors in muscle cells, triggering increased protein synthesis and tissue repair. Medically, they treat hormonal deficiencies, delayed puberty, and certain muscle-wasting diseases. However, when used in high non-medical doses, they cause significant hormonal imbalances. In men, excess use suppresses natural testosterone production, leading to testicular shrinkage, infertility, and mood instability. In women, it causes deepened voice, body hair growth, and menstrual irregularities. Both sexes risk liver damage, elevated cholesterol, hypertension, and heart strain. Steroids also affect brain chemistry, increasing aggression and irritability, a phenomenon known as roid rage. Withdrawal can cause depression and fatigue as hormone levels crash. While short cycles can yield visible muscle growth, long-term abuse permanently disrupts endocrine and cardiovascular systems, making recovery difficult without medical intervention. Ayahuasca is a traditional Amazonian brew made from two main plants, Banisteriopsis caapi, which contains MAO inhibitors, MAOIs, and Psychotria viridis, which provides the psychedelic compound DMT. The MAOIs prevent the body from breaking down DMT in the digestive tract, allowing it to enter the bloodstream and reach the brain. The experience typically lasts 4 to 6 hours and is characterized by intense visual and emotional effects, including vivid hallucinations, reliving memories, and a perceived connection to spiritual or ancestral realms. Physiological reactions include nausea, vomiting, sweating, and trembling, often referred to as purging, which traditional shamans view as cleansing. Ayahuasca temporarily alters serotonin regulation, which can lead to dangerous interactions with antidepressants or stimulants. While studies suggest potential therapeutic effects for PTSD, addiction, and depression, improper use or unsupervised settings can result in psychological trauma or medical complications due to its powerful neurochemical impact. Phencyclidine, or PCP, is a dissociative anesthetic first developed in the 1950s for surgical use but later banned due to its extreme psychological effects. It acts by blocking NMDA receptors in the brain, disrupting communication between neurons involved in perception, pain, and emotion. This causes detachment from reality, distorted sensory experiences, and a false sense of invincibility. At low doses, PCP produces euphoria and numbness. But at higher doses, it induces confusion, hallucinations, violent agitation, and psychosis resembling schizophrenia. Physiologically, it raises heart rate, blood pressure, and body temperature while impairing coordination and speech. Because PCP suppresses pain perception, users often injure themselves without realizing it. Long-term exposure damages memory, concentration, and emotional stability. Overdose can lead to seizures, coma, or death. Even after single use, lingering paranoia or depression may persist for weeks due to its prolonged storage in body fat.